This is Group 1. Our members are Judy Akers, Phyllis Anthony, Amy Beeler, Breanne Blackwood, Elizabeth Bubb, Taylor Burnett, and Emily Byers. Our presentation is over Berkeley Eye Center. The tradition of excellence began in Houston 50 years ago when Ralph Berkeley, MD, opened his first ophthalmology practice. Berkeley Eye Center, unprecedented, committed to patient care, advanced surgical expertise, and superior results, have made Berkeley Eye Center the most trusted name for Houston eye care. Berkeley Eye Center is one of Texas' most established full-service eye care facilities. Their services include routine family eye care, glaucoma management, dry eye treatment, diagnostic testing and treatment for diabetic eye disease, cataract surgery, retina care, the latest lens implant technology, and LASIK laser vision correction and cosmetic eye surgery. What is ophthalmology? Ophthalmology is a branch of medicine that deals with the anatomy, physiology, and diseases of the eye. An ophthalmologist is a specialist in the medical and surgical eye problems. Since ophthalmologists perform operation on eyes, they are both surgical and medical specialists. Ophthalmologists are the only practitioners medically trained to diagnose and treat all eye and visual problems, including vision services, such as glasses and contacts, and provide treatment and prevention of medical disorders of the eye, including surgery. The requirements to become an ophthalmologist in the United States are the completion of 4 years of college, 4 years of medical school, and 4 to 5 years of additional specialized training. How to become a general ophthalmologist. To become a general ophthalmologist, the specialty requires 4 years of postgraduate specialty training after the completion of a medical degree. This requirement includes a 3-year residency in ophthalmology in an approved surgical residency program, following at least a 1-year internship. An ophthalmology residency includes training in the fundamentals of all of the above specialty fields of ophthalmology. This training period prepares the person for a thriving practice with surgical cases that involve fascinating and challenging microsurgery. Ophthalmic surgery requires exquisite hand-eye coordination and surgical skill. As an ophthalmologist, one routinely uses sutures that cannot easily be visualized with the unaided eye. Cataract surgery and basic glaucoma surgery are two of the most common procedures an ophthalmologist routinely performs that requires such skill.
As a native of Texas, Dr. Berkeley received his medical degree from Baylor University College of Medicine. After internship at Houston Herman Hospital, Dr. Berkeley served as a flight surgeon in the U.S. Air Force and completed his residency in optical at Precision Hospital in New York. Berkeley, who has been practicing ophthalmology since 1960, founded the Houston Eye Clinic, which emerged into Berkeley. Berkeley performed the first laser eye correction procedure in Houston, and then continues to be active in the advance of cutting-edge technology in the eye care industry. Today, Berkeley Eye Center features 16 eye centers locations. In addition to the laser centers in Greenway Plaza, the Woodlands, Katy, and Corpus Christi. Ralph G. Berkeley, MD, is included in the procedures list of top surgeons nationwide in reference in cataract surgery. Dr. Berkeley has been honored by his as one of the best doctors in America. Board of certifications by American Board of Ophthalmology since 1961. Dr. Berkeley is recognized as as a pioneer of refractive surgery. He began performing refractive surgery in 1979 and has performed many thousands of procedures. Dr. Berkeley is also among a group of clinical investigators who were selected to be involved in the approval process for the extreme laser, including elastic laser vision correction. Dr. Berkeley continued to be involved in current clinical research for advanced laser procedures, including the investigation of an intraocular laser implanted designed for current model high pathologies. David has been the director of human resource for the last 14 years at Berkeley Eye Center, but has been a part of the Berkeley family for the last 25 years. As Director of Human Resource, David oversees numerous departments and is responsible for different roles in the company. David oversees the administration of Employee Handbook and the Patient Survey. He is directly in charge of recruiting, interviewing, organization benefits, and terminations. The most frequent task David attends to do in his position is the interviewing. He is responsible for hiring and recruiting every position that is needed to be filled for the 16 different Berkeley Eye Center offices located all over Houston, Texas, and Corpus Christi, Texas. On top of this, David also organizes and presents during weekly meetings with other employees of Berkeley Eye Center.
When we asked Mr. Burnett about the disadvantages and limitations of being the Director of Human Resources for Berkeley Eye Center, Mr. Burnett replied with a few different things. One disadvantage of his position is the responsibility of termination. Firing an employee for any reason is never an enjoyable task, but every now and then it needs to be done, and Mr. Burnett is always the one who has to deliver the bad news. Another disadvantage, he said, was the continual consideration of the cost of health care benefits, factoring into making decisions and choosing plans. One of the limitations about his position, Mr. Burnett mentioned, is the financial limitations to keep good people and good employees, and that there are only so many opportunities to grow in the practice. And because of that, sometimes the company will lose employees because there is not an opportunity for them to step up. Another limitation that he mentioned was that he feels the government gets a little too involved regulating the workplace. Also, the possibility and risk of lawsuits can come directly in his department.
David enjoys the profound impact that he has on the workplace environment, and when people enjoy their job in the company, it brings him great satisfaction. The responsibility of molding the company is something that David takes pride in. He enjoys the responsibility to help shape the culture within the practice. Berkeley Eye Center expects a specific kind of workplace employee, and such advertises for this kind of person to apply. Since they offer good benefits and want a very friendly atmosphere, they expect their employees to present themselves in a professional way and conduct themselves appropriately. David Burnett is very cautious about changing the current culture at Berkeley Eye Center, and he's very proud of his organization and their numerous strengths. Job postings are posted internally and externally, but they are also posted through the Berkeley Eye Center weekly company newsletters to try to hire within the company. More positions have been created within the upper administration and the upper management for current people to better their positions. Several office managers will be retiring in the next few years, so a training program was created proactive. Involves existing staff and outside hires with management experience but who are new to vision care environment. Berkeley Eye Center values its individuals who are upbeat, dependable, skilled, and flexible in their work. In return, employees are offered a salary and benefits package that allows the employees to have a work-life balance. Some of the benefits for a full-time staff member would include health insurance, dental insurance, free basic vision care for you and your immediate family, substantial discounts on optimal products and surgical procedures, free life insurance and long-term disability, participate in a 401k program, corporate discounts, flex benefits, and health savings accounts.
Free life insurance and disability packages offered for full-time employees of the company. Paid time off. Employees have the opportunity to earn 18 days of paid time off annually. In addition, full-time employees are eligible for 8 paid holidays a year. Growth opportunities. About 70% of the Berkeley Eye Center management team moved into their current role from another position. Berkeley Eye Center also supports job-related continuing education, including JCA HPO and ABOC certification. Since 2011, Berkeley Eye Center has been recognized every year as a Houston Top Workplace. With a lot of competition in the industry, Berkeley stays competitive by offering affordable care with a variety of services. They offer their employees a competitive salary, full benefits, great work environment, and stability. The interview with Mr. David Burnett gave us an insight of what a human resource director deals with on a day-to-day basis. Also, how their career development plays an important role in retaining their employees.